Now, the death toll from the novel coronavirus outbreak has now reached 638, and more than 31,000 people are said to have been infected by this deadly novel coronavirus in just mainland China. The central Hubei province continues to be worst affected. Within the province, the casualty count is said to be about 618, accounting for almost about 97% of all people being killed so far by the infection. The Wuhan's hospitals have been overwhelmed by the sheer number of patients. And yesterday we told you about how there was a major scarcity and shortage of beds and other medical equipment. But this morning there is some good news on the front, because the newly constructed Shan Hospital in Wuhan is now reportedly ready to admit patients affected by the novel coronavirus. All right, now to give us a sense of what's unfolding presently in China on the ground, we're joined in by our correspondent Patrick Falk, who I'm given to understand is joining us live from Hong Kong. Good afternoon to you, Patrick. Now, the death toll has now risen to 638 so far, and despite the best efforts that the Chinese administration claims it is doing, the number of deaths and the number of infections continues to rise. What's happening on the ground there?
Well, they continue to climb, but as a matter of fact, the rate of deaths in Hubei province has actually slowed down ever so slightly just in the past 24 hours. It's probably too early to say whether or not that's a meaningful change, but President Xi Jinping has actually been on the phone with Donald Trump to say that China will defeat this outbreak and will get it under control, and also has said that the impact on the economy would be temporary. Of course, there's a lot of concern in the U.S. about how this is going to affect the trade deal between the two countries and whether or not China is going to be able to ramp up exports as it's pledged to do. So that's possibly part of the reason why that phone call was made. And of course, China has also been criticizing the U.S. For spreading fear about the virus as well.
Absolutely, indeed. And also, there is a lot of controversy that is swirling around in terms of what was happening with the whistleblower Li Wenliang, whose death was confirmed yesterday. What's been the reaction by the Chinese administration on this front?
Yeah, well, there certainly has been a real outpouring of sorrow and anger. Li Wenliang, one of the first doctors to try and warn the world of this deadly outbreak. Of course, he was actually reprimanded by authorities a month ago. He was accused of spreading rumours and was actually asked to sign a form that he was causing a social disturbance of sorts. But yes, he has now died, and a lot of people are now saying that they hope he did not die in vain. And, you know, even if the impact on the economy is limited, there's a good sign that, you know, incidents like this may have a longer lasting effect and will cause anger, particularly towards the government as a result.
Right, and also, you know, we've been seeing reports in terms of how life has been impacted within China because of the outbreak of this virus. You know, we saw this report that was sent by one of the journalists there as to how streets in central Beijing wore a completely deserted look. You know, how has life, day-to-day life for the common people been so badly impacted? Is food easily available in the markets? How easily are medical supplies to come by? And if someone would be feeling ill, perhaps for whatever reason, how easy is it for them to access medical facilities?
Well, the situation in Beijing is certainly very different to Wuhan. Certainly not the same sort of desperation there. But as you know, I've come from Beijing down to Hong Kong today. There is still a very sort of quiet state of affairs in the capital. Businesses are still shut. People are taking the matter very seriously and making sure that they're all covered up with face masks and so on and so forth. And everyone's really watching very closely at how things are developing in Wuhan. There is, of course, a lot of concern that there's going to be outbreaks beyond Hubei province. Here in Hong Kong, there have now been, it's now suspected that there have been 3 cases of human-to-human transmission that occurred locally because 3 of the people that were infected had no travel history in the last 14 days, not just China, but anywhere else at all.
Right now, the doctors are, of course, in a desperate race against time to try and develop a virus, to develop a vaccine or a cure for this disease. How much closer has the world moved in terms of finding that cure or vaccine for this deadly novel coronavirus?
Well, clinical trials are underway, and China is trying to speed those up. As far as we understand, what is working at the moment is not so much a vaccine, but antiviral drugs that are typically used for flu and HIV. Those are proving effective, or they have proved effective in some patients, and that's been demonstrated quite a few days ago now by a Thai patient who responded well to that treatment. But with regards to actually developing a vaccine and getting it into the market when people can use it, we could still be some way off, and there's a particular concern in the coming days. A lot of experts are predicting that within the week or next week or two that the virus could peak. We're now at over 31,000 confirmed cases of infections. A lot of people suspect that number could be a lot higher, in fact, because they're saying that in Hubei province, and particularly in Wuhan city, that they're running out of test kits to actually check if people have contracted the disease. So that figure could already be a lot higher. And all of a sudden, some of the numbers that people have spoken about previously, some experts in Hong Kong have suggested there could be 75,000 cases in Hubei province. All of a sudden, it doesn't sound that far-fetched.
All right, Patrick Falk, thank you very much indeed for joining us from Hong Kong and getting us those insights in terms of this race against time that the medics are, of course, putting up in trying to come up with a cure for this, and also what life looks like presently within China after the outbreak of this novel coronavirus. And also